Prostate cancer is the second most common cancer diagnosed in men worldwide. And the reason it is so often caught late is not because the warning signs do not exist. It is because men consistently mistake those signs for normal aging and say nothing. Today I want to give you the 8 most important early warning signs that prostate cancer produces, explained not just as a list, but with the clinical reason behind each one. Because when you understand why a symptom happens, you are far more likely to take it seriously and act on it. I also want to be clear about something the competitor videos on this topic rarely say. Many of these signs overlap with benign conditions. A symptom on this list does not mean you have cancer. It means you need to be evaluated by a urologist. The goal of this video is awareness and action, not fear. My name is Dr. Elizabeth Kavaler. I am a board-certified urologist with over 20 years of clinical practice. I have diagnosed and managed prostate conditions throughout my career, and I work with men experiencing these symptoms every week. What I am sharing today is based on published clinical guidelines from the American Cancer Society, the American Urological Association, and peer-reviewed urological research. Before I walk through the signs, there is something clinically important you need to understand that almost no other video on this topic explains. The prostate gland surrounds the urethra, the tube that carries urine from the bladder out of the body. This means that both benign prostate enlargement, called BPH, and prostate cancer can produce similar urinary symptoms because both conditions affect the same anatomical structure. The difference is that BPH is extremely common after 50 and is not cancer. Prostate cancer in its early stages may produce identical urinary symptoms, no symptoms at all, or a combination of urinary and non-urinary signs that are subtler and easier to dismiss. This is why seeing a urologist and getting a PSA blood test matters. A symptom alone cannot tell you which condition you have. An evaluation can. Keep that in mind as I go through each sign. Sign 1. Weak or interrupted urine stream. When the prostate enlarges due to a growing tumor, it compresses the urethra and reduces the force of urine flow. Men often describe this as a dribbling stream, needing to strain to start, or the flow stopping and starting mid-urination. This is one of the most common early urinary signs of both BPH and localized prostate cancer. Sign 2. Frequent urination, especially at night. The medical term for waking multiple times at night to urinate is nocturia. When the prostate compresses the bladder outlet, the bladder never fully empties. Residual urine irritates the bladder wall and creates a persistent sensation of fullness. Most men over 60 who wake 2 or more times per night to urinate accept this as normal. It is common, but it is not something to simply accept without evaluation. Sign 3. Difficulty starting urination. This is called hesitancy. It occurs when the compressive effect of the prostate on the urethra requires the bladder to generate more pressure than normal to initiate flow. Men describe standing at the toilet for 30 to 60 seconds waiting for flow to begin. When this pattern develops or worsens, it warrants evaluation. Sign 4. Sensation of incomplete bladder emptying. After urinating, many men with prostate issues feel as though the bladder is still partially full. This is because it often is. Residual urine volume increases as the prostate obstructs outflow. Over time, this can lead to urinary tract infections, bladder damage, and kidney complications if left unaddressed. Sign 5. Blood in the urine or semen. The medical term is hematuria for blood in urine and hematospermia for blood in semen. Both can occur when prostate tissue or nearby blood vessels are disrupted by a growing tumor. Any episode of visible blood in urine or semen in a man over 50 should be evaluated promptly. This sign does not always indicate cancer. There are benign causes, but it requires clinical investigation without exception. Sign 6. Erectile dysfunction that develops or worsens suddenly. The nerves responsible for erectile function run alongside the prostate gland. A tumor growing in or near the neurovascular bundle can directly impair erectile function. Gradual age-related decline in erections is common. A relatively sudden change in erectile function in a man with no prior erectile difficulties is a more specific signal that deserves investigation, not just an online supplement purchase. Sign 7. Pain or discomfort in the pelvic region, lower back, or hips. Early-stage prostate cancer is typically painless. However, locally advanced or regionally spreading disease can produce a dull ache in the pelvis, the area between the scrotum and rectum called the perineum, the lower back, or the hips. In men over 60 who develop unexplained persistent pelvic or hip discomfort that is not explained by a musculoskeletal cause, prostate evaluation should be included in the workup. Sign 8. Unexplained changes in the PSA trend on routine blood testing. This one is different from the others because it is not a symptom you feel, it is a laboratory finding. Many men over 50 who are having routine annual physicals will have a PSA measured. A PSA value that is rising consistently year over year, even if it remains within the technically normal range, is a pattern called PSA velocity. Research published in the Journal of Clinical Oncology has shown that PSA velocity is an independent predictor of prostate cancer risk. If your PSA has been rising each year, that trend deserves a conversation with a urologist, regardless of the absolute number. If you recognize one or more of these signs, here's what to do. Request a PSA blood test from your primary care doctor. PSA stands for prostate-specific antigen. It is a protein produced by prostate cells, both normal and cancerous. Elevated or rising PSA does not diagnose cancer, but it is the most valuable initial screening tool available, and it is a simple blood draw. The U.S. Preventive Services Task Force currently recommends that men between 55 and 69 discuss PSA screening with their doctor, weighing individual risk factors including family history and race, with Black men carrying a significantly higher lifetime risk of prostate cancer. For men over 70, the decision should be individualized, as we discussed in a previous video on screening after 65. Your doctor may also perform a digital rectal exam, commonly called a DRE. I understand this makes many men uncomfortable, but it takes less than 30 seconds. It adds important information that a PSA test alone does not provide, and it could be the examination that identifies an abnormality requiring further investigation. Discomfort for 30 seconds is an entirely reasonable trade for that level of clinical information. If your PSA or DRE raises concern, the next step is typically a prostate MRI and possibly a biopsy guided by the imaging. The diagnostic pathway is well established and, when followed early, gives you the widest range of treatment options. Your risk of prostate cancer is significantly elevated if you are over 65. If you are Black, with research showing Black men develop prostate cancer more frequently, at a younger age, and with more aggressive characteristics, or if you have a first-degree relative, a father or brother, who has been diagnosed with prostate cancer. These factors should lower your threshold for discussing PSA screening with your doctor, and doing so before you have any symptoms at all. Obesity, a high-fat diet, and low physical activity are also associated with increased prostate cancer risk, and with more aggressive disease behavior in multiple published studies. The men who do best with prostate cancer are the ones who caught it early. Not because they were lucky, because they paid attention to their body and they made a phone call to their doctor. Every sign I covered today is manageable when found early. The same signs ignored for 1 or 2 years can represent a very different clinical conversation. You watched this video. That means you are paying attention. Now make the call. I am Dr. Elizabeth Kavaler. I will see you in the next video.